Dr. Dodum, Tara TECHI from outcome of Parspalana Aurolab aqueous drainage implant in vitreous cavity in neovascular glaucoma.
Hello. Good afternoon, everyone. Our study is on Parspalana placement of Aurolab aqueous drainage implant in neovascular glaucoma in Indian eyes. So NVG is a severe form of secondary glaucoma with refractory IOP and poor visual prognosis in most of the cases. This study retrospectively evaluates the post-operative outcomes of RD implantation via Parspalana, focusing on its effectiveness in IOP control and visual preservations. The aim of the study is to see the outcomes of Parspalana placement of Aurolab aqueous drainage implant in neovascular glaucoma. So a study was conducted in Arvind Eye Hospital, Tirunelveli, in the Department of Glaucoma and Retinal Services in 28 eyes diagnosed with NVG with the Parspalana placement of RD and had a minimal follow-up 12 months. And a patient excluded were patient with less than 12 months and less than 18 years of age and monoocular patients. So the success criteria, we had two success criteria, one with IOP less than 18 mm of Hg or more than 5 mm of Hg or 30% reduction from baseline. And another one was less than 15% IOP or more than 5% of mm of Hg or 40% reduction of IOP without AGM. The qualified success was the same, but it was included with one AGM. So this is demographic and baseline clinical characteristic of the patients. So surgical procedures was done by both clinical glaucoma and retinal surgeons. So first of all, the glaucoma surgeon has done inferior nasal peritomy and the plate, after isolating the muscles, the plate and creating the scleral tunnel of about 4 mm. The plate was fixed at around 10 mm away from the limbus, and then the rest of the procedures like inserting the tube into the vitreous cavity was done by the retinal surgeons. So as a result, out of 28 eyes, the mean IOP presented was preoperatively was 46.21, which was reduced to 19.64 in week 6, and till 12 months it was 22.67. And AGM reduced from 3 to 1.52 in 6 weeks and 1.752 in 12 months. So the BCVA was stabilized or improved in 54% of the eye in 2 months and 66% of the eyes at the end of the 12 months. So as for the criteria one, the success rate achieved was 50% till 12 months and qualified success was 83.3%. And as per second criteria, which was more stringent, was 37.5% in 12 months and qualified success was 72.2%. So there was occurrence of at least 1% of adverse events like failure of external blood formation, hypema, loose suture, subtotal hypema, RD and tube occlusion in our studies. So in our study, we got 50% reduction of IOP and 58.3% reduction of anti-glaucoma medication as compared to the other studies. And we had a complication rate of about 21.4% as compared to 30% and 65% as compared to the other studies. So the strength of our study was that this is the first study with the largest sample size assisting non-bulb RD implantation in Parspalana, especially in diagnosed NVG case in Indian eyes. And the limitation is a retrospective nature and lack of control. So to conclude, our study saw that RD is safe and effective for Parspalana implantation with vitrectomy in terms of controlling IOP and maintaining visual acuity in NVG cases. Thank you.
Good presentation. How does it work?
Sir?
How does it work?
Sir, basically, we did this study is because RD is presumed that it will start working after 6 weeks. And in NVG, most of the surgeons feels that this is contraindicated. But sir, we did this actually just wanted to see whether like in this NVG, because the visual deterioration are seen very fast. So just wanted to see that, but in our study we didn't get that, sir, actually.
No, I mean to say, how does it work?
What is the mechanism?
What is the mechanism of?
Oh, sir, basically it works as the same like the other. Basically, the ligation is done, and after the ligation opens up in 6 weeks, so we are expecting the IOP to be lowered, and that in our study we have seen that also. Like, sir, after doing the surgery, we'll keep the patient with some AGM until the ligation is open, and then after that.
No, I mean to say, what's the mechanism? What's the mechanism of action? How does it lower the IOP?
Oh, sir, that is how. First of all, after the ligation, there will be bleb encapsulations over the plate, and it takes time at least to this period when the tube opens. So it controls. In RD especially, there will be like fibrous ingrowth from the plate, and then it will anchor, and it will maintain that float. Basically, it is the fluid will flow from the ultimately from this blade area, it will flow into the subconjunctival space and into the
Episcleral
yes.
movements.
Okay.
What are the exclusion criteria?
Ma'am, exclusion criteria, we we excluded patients who were monoocular, less than 18 years of age, and patients who didn't follow up for 12 months, sir.
Okay. And preoperatively gonioscopy was done, and there was any like patients with rubiosis iridis or something, or like some new vascularization in angle, anything that you have included, or you have excluded these?
Ma'am, it is there, but we have a protocol, like first we will do the laser, then injection if possible, or sometime like during the intraoperative also we'll give the injection and do the surgery.
Okay. So after these various maneuvers, then you planned for this type of surgery?
Yes.
Okay. It's good.
Okay.